This is quite extraordinary. Dr. Tedros, the Director General of the WHO, convened this emergency committee on Thursday. They couldn't reach a consensus. He, as you said, decided to declare monkeypox this public health emergency of international concern anyway. And it's worth understanding what that means. It basically means it's the highest level of alert that the WHO can issue, and it means that this disease potentially needs a global and coordinated response. Now, take a listen to what Dr. Tedros said were his reasons behind declaring it.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Now, at the moment, Dr. Tedros said the disease is concentrated among men who have sex with men, but it was very clear that he and others, other WHO experts, were really keen for this to be taken very seriously, despite what slice of society the illness currently affects. And the reason why it's concentrated right now, it actually could make it easier to contain with the right strategies, they said. Now, globally, at the moment, there are more than 16,000 cases of monkeypox, 2,000 of those, just over that, here in the UK. But there have thankfully been only 5 deaths, all of them on the African continent. The disease has been around since the 1970s. The main symptoms are fatigue, some lesions on your skin, and it's kind of like flu-like symptoms. That's why it's somewhat difficult to diagnose in its early stages. But it's also worth noting that the UK is rolling out a system of vaccination. It's targeting about 100,000 vaccines at those people at risk. And another important point is that there is a general consensus among scientists that while this illness is worrying, it can be dangerous for some people. Overall, it is a milder clinical picture than COVID, and for most people, it won't result in death. But still, worth taking caution. The WHO really taking it very seriously.